Now I want to open it up to questions. And so everyone who goes to the microphone, there's one on my right, one on the left. Just line up, go to them, so that we can go through this fairly quickly. Anne-Marie, I think.
Thank you. First, I wanted to just tell Magali.
Tell everybody who you are.
Oh, I'm Anne-Marie Kimball, and I'm here at the University of Washington, and I want to tell Magali because she said, and then I got a PhD, and here's what really happened. She came in my office, and she said, Anne-Marie, do you think I could have one more quarter's worth of funding because I finished all the PhD required classes, and all I need is one more quarter, and I could move into the PhD program? And the answer was yes. So I guess the one thing there is be flexible. If you say you're going to do masters, don't be narrow. But the other thing I would say is that what we found, and you'll hear more when we talk in the next session and the other sessions with Cayetano, was really, really key, was what Magali said about, and then I had a stable position at UPCH. Then I could bring my own funding, then I could have my own networking, and I could create my own grants. And that intervention of the reentry grants that came along from Fogarty, absolutely critical to our ability to have 80% of our informatics graduates return to Peru and be employed in Peru. Thanks.
Great. Thank you.
Yeah, is this on? Yeah.
Yes.
My name's Einters. I'm from Indiana University. I'm one of the co-founders of AMPATH, and I direct the AMPATH Consortium. Congratulations to all three of you. You did a terrific job. It was really good. My question is, I think, for the three gentlemen on this side, though. I appreciate, first, of course, all of us love what Fogarty does. You've done a remarkable job with really very little resources, and I applaud you, Roger, for what you've done. But I wonder if you can't even take it yet one step further. I come at it, of course, from the perspective of Moore University and the faculty there at Moore University. And I see a couple of things. One, I worry that the emphasis on research and the funding that comes as a research supplement has the potential, and in fact has happened on occasion, to suck some of the best and brightest out of the institution of the medical school, and they focus almost exclusively on research. And so it's not institution building. And in fact, it is counter to institution building. Perhaps there's no other way. Perhaps, as you say, Fogarty needs to focus on the individual and really work on bringing up the individual. But I wonder if the question really is two. One, how do you, or how do we, as you as Fogarty, we as institutions, really build the tripartite mission? Not just research, not just education, but research, education, and care service. And then number two, how do we build the faculty through research? In other words, how is the payment made to the faculty so that Kenyans, or others, but Kenyans can remain on the faculty there in Kenya, happy, secure, and pursuing their careers?
Roger, do you want to take the first stab at that?
It's a wonderful and challenging question. You know, and all research institutions in the U.S. have this tripartite of research, service, and training. And to be promoted, you have to be good in two of those. There are a lot of people who are great clinicians. There are a lot of people who are great educators. There are some people who are good researchers, and it's really trying to find a balance in career that allows people to mix and match. And to have people who can get grants and can get independent funding grow up and be really good researchers, while others who aren't competitive in grant writing but are wonderful teachers or service providers to do what they do best. I don't have a simple answer, and I think in every institution it varies. It's clearly a concern. I would say that you're on the ground in Moy, and I've never visited Moy. So I would almost have to depend upon help and information and insights from your own experience that might help us to direct our programs to that particular glitch. Because I know in other areas we have problems of people who we fund for research who never get full time to do that. So it works both ways. Be happy to discuss that with you further, and we're always open to suggestions. I think we don't, I thought the presentation today of Hans Rosling, that every country is different, and we can't have one solution that fits all. And I think that these presentations are. I just wanted to highlight on these presentations that to me they were the high point of this discussion this morning. And one of the challenges I get as we think about things like the Global Health Initiative is how do we evaluate success? If you take any one of these three characters who presented and say, well, would we invest in them for 5 years or 10 years based on what they were going to do before they went out, or now, or in 5 years, what would you say? Because I think of Krista, I mean, if after 1 year she had gotten a little screening program in IRB, after a year it was up to 3,000, after 2 years it was 10,000, after a couple of years, 50,000. If she went in with a grant to say, I was going to do screen 50,000 and set up a program, you'd say, oh, come on, she'll never do it, impossible in those settings. And we never would have funded her. Having done what she's done, we need to have some intermediate markers for success for each of them, because they're really on, each of them is on their own research trajectory, which is game-changing, life-changing. And it's very hard with short-term goals, such as let's reduce malaria by 50% in 5 years, let's screen for hypertension or cervical, to have goals like that we don't think about the long-term implications and the sustainability of investments in education. And I think that's a difficult area to deal with and to market against people who have very short-term goals of how many people will put on antiretrovirals this year. We never ask how long we'll sustain them or who will train them, treat them in the future. And I think that's a real challenge for anyone like me who's trying to defend a portfolio of training in the presence of people who are in the healthcare delivery sector.
Yeah, and I'd like to talk to you afterwards. I don't want to detract from this, but in some opportunities, I do think research can be enhancing in the sense that they get exposure to clinical care and they get exposure to training. And I think each of the three, afterwards, you could talk to the three and see if they missed out on either of those. And if so, we can try and improve upon that. Now, we are getting close to the end, so I see two people at the microphone, so why don't we go to the left, and Patty, you can have the last word.
Okay, thank you very much. I just, I had a grant from the Fogarty International Center several years ago and had wonderful experiences meeting at the NIH and sharing ideas. It was under the program on health and economic productivity. And so for 5 years we met, a group of us, researchers and Fogarty International Center staff, to discuss what are the next steps, how do we work with other countries and so on. And so I don't know if this is already taking place in Fogarty, but I have an ambitious proposal, which is that I really believe that we need to figure out a way to bring to the table academic institutions, researchers from other countries to sit down with Fogarty International directors, project officers, etc., and really brainstorm about all the many ways that we can work together without needing a lot of money and without making the process so difficult for people from other countries who can, at the end of the day, give a lot to Americans. Because I understand, yes, there has to be something in return for the American effort to reach out to other countries.
Roger, before you take that on, Patty, why don't you ask your question and then we can open it up.
Yeah, well, first of all, if somebody is doing...
announce to the rest of the group who you are.
My name is Patty Garcia. I work in Peru at the Universidad Peruana Cayetano Heredia. And I trained here at the University of Washington in infectious diseases and in my master's in public health through the Fogarty. So one of the things that I wanted to say was that I think that if somebody is doing something for global health, that is Fogarty. And that's something that we have to really recognize, and coming from a developing country. And Marie was saying one important issue. I mean, when people go back, trying to get a formal position in our countries, which is not easy. But one of the things that had helped, and I think that has to do with Fogarty also, has been this issue of trying to create a critical mass, which means more people trained that are coming back, and we all together working, okay, creating the force in order to, from the bottom and from up down, also try to convince the authorities at the university that it's a good thing to open positions for new people like Magali and like others, because we have several other Peruvians that are young Peruvians, are my sons and my granddaughters and my grandsons that are already working there. So I wanted to bring this because it's so easy to say, but it has taken us years to really be able to open these positions within the university. But that's thanks to the fact that we have been pushing and creating this critical mass of several people. But then the question, Roger, because I want to challenge you, because we have been talking about this. We're working on these issues, but we need also, sometimes it's not only money, but it's also recognition. And we were talking about this issue about the centers of excellence, okay? I know that there is a grant of centers of excellence in chronic diseases, and actually Cayetano has one by one of our junior people also, okay? But this issue of centers of excellence recognized officially by Fogarty, I think are going to help on this advocacy even within our countries. We have talked during the conference a lot about Africa, but we're forgetting Latin America in some way. We can be like in the middle, so a little push can help us to fulfill whatever is needed. And that can help also to push other countries in the South, because we can help with this South-to-South collaboration. So where are we standing on that idea, Roger? Thanks.
Patty, good questions. You know, one thing about one area I'd like to speak to is the idea of critical mass and centers of excellence, because we recognize that, and one way we've adapted our programs to that is that for those research centers like yours, which have a number of investigators, which have attracted funding from different institutes and centers at NIH and elsewhere in the world, that work with different U.S. universities, is to help by supporting programs in bioethics, which are common grounds for everyone, programs in informatics, and now a program with NICHD, the Child Health Institute, for grants management, so that when you have accountability for NIH grants or other grants, you can have someone actually trained in grants management through Fogarty and NIH, NICHD programs. So we're trying to work to build up centers of excellence like that. I actually like the idea of giving designations of centers of excellence, like WHO gives reference centers for disease. It costs them nothing. They have WHO centers around the world. It costs them nothing, but it does allow them, allows the centers to barter for money. And I know at CDC, I was a center of excellence for gastrointestinal disease. We got $50,000 from CDC because of that designation. So that's a wonderful idea that we should promote. And your last, I'm sorry, your last question? Okay.
Yeah.
Now, I think for Latin America, though, we've seen the growth of activities in Latin America from NIH, and the NCI has actually a multi-center trial set up for improving cancer investigations in Latin America.
So on behalf of Sten and I and the organizing committees of CUGH, I want to thank the panelists for really very important presentations. Thank you very much.
Please remember, if you're interested in the program, there are materials down here on your left.